It is another edition of your favorite program, Health Affair on AIT, and I'm your regular anchor, Oshuomowa Daniels. You're welcome. On the program, everything about health is our concern. We also focus on issues about women and children with a view to finding lasting solutions. On this week's edition, we shall be focusing on health insurance scheme. As is usual for us, let's bring you news about recent happenings in the health sector before we dive into the issue.
The Director, Health Inequalities, Dr. Bola Owolabi, has revealed a major breakthrough drug for those battling sickle cell anemia. While speaking, she revealed the name of the drug as crizanlizumab and added that in the next few years, over 5,000 affected persons will be treated. Dr. Owolabi also commended her colleagues in the pharmaceutical section who worked round the clock to ensure that the drug is certified. The Pharmaceutical Manufacturers Group of the Manufacturing Association of Nigeria, PMG-MAN, has hailed an experimental drug for severe COVID-19 that cuts across the risk of hospitalization or death by about half. Interim clinical trial results show the tablet molnupiravir was given twice a day to patients recently diagnosed with the disease. United States drug maker Merck said its results were so positive that outside monitors had asked to stop the trial early. The chairman, PMG-MAN, Fidelis Anyebe, said the game-changing discovery puts a halt to the craze for vaccine manufacturing temporarily and provides people with more options. He added that if molnupiravir gets authorized by regulators, it would be the first oral antiviral medication for COVID-19. After over 14 years of engagement at the global level, Dr. Osahan Enabulele, a chief consultant family physician, has emerged as president-elect of the World Medical Association, WMA. His emergence, which followed an almost one-week period of voting by participating national medical associations, is a testimony to his global acceptability and recognition of his many years of hard work within the WMA. With this historic development, Dr. Enabulele has once again attained another milestone by being the first ever Nigerian and West African physician to be elected president of the World Medical Association. He will be expected to give his acceptance speech during the London 2021 General Assembly of the World Medical Association, billed to hold on Friday, October 15, 2021, and will be superintending over the World Medical Association during the 2022 to 2023 executive year.
Football team is because there's a lot of energy in the communities where we work, a lot of energies. Like I said earlier, there are girls that can beat up 10 boys. They're so strong. And so there's a need to harness these energies into sporting opportunities. And you never can tell how far these children will go.
October 11th, 2021, the International Day of the Girl Child, witnessed a lot of fanfare and activities to celebrate girls across different states of Nigeria. For Betty Abba, a girl child advocate, and some other stakeholders, such celebration should go beyond the yearly routine and translate to policies that will put a stop to all negative circumstances militating against girls.
Everyone should see themselves as stakeholders when it comes to the girl child. Everyone should see themselves as protectors of the girl child. Everyone should see themselves as the people that will be affected whenever a girl child is neglected or is abandoned.
Do not treat your girl as a second-class citizen. Do not say because she is a girl, all she has to learn, all the skills she has to learn has to be cooking, sewing, and all that. Give your girl child the same opportunity you gave to your boy child.
The future is female. Don't allow anybody to take your future from you.
With the theme, Digital Generation, Our Generation, they urged girls to be focused and shun the negative vices going on in various social media platforms. Issues about menstrual hygiene and security of girls in the face of emerging threats also came to the fore.
The kind of precautions that a girl child needs, requires, deserves, it's not like any other person, it's not like any other gender, it's not like any other age grade. Because a girl child can easily, is just like an egg that can easily be damaged through teenage pregnancy, through sexual abuse and all sorts of things. So a lot of gender-based violence going on, and the people affected most are women and girls, especially girls.
Over the years, the girl child in Africa, especially Nigeria, has been saddled with numerous challenges such as house chores, sexual violence, early marriage, lack of access to quality education, and many other factors that have put her at a disadvantage with the male folks. The convener, Arise Women Conference, Dr. Shiju Iluyomade, has appealed to Nigerians to cultivate the habit of regular exercise, especially working, to stay healthy. Speaking at the World Press Conference on the 2021 Arise Work for Life with the theme, I Choose Life, holding on Saturday, 16th October 2021, Dr. Iluyomade noted that the impact of the COVID-19 pandemic was less on Nigerians because most people have been active in their way of life.
We had imbibed something which all of us didn't recognize easily, and that was that we work every day. The poor man sees it as is not rich, that's why he's working. The poor man thinks the sun is beating him, that is why he's working. But when COVID-19 came, we found out that what the poor man, or the man who felt less privileged, or the woman who felt less privileged, was thinking was a disability or a challenge, was what has saved our nation, Nigeria. We did not have great community transmission of COVID-19 because you could get your vitamin D. You could get vitamin D from just the sunlight. And you had enough exercise, which you were taking every day. And that exercise keeps your organ going. It gives you immunity. It boosts your system. Our Arise has been in the forefront of healthcare delivery. We have our mobile clinics, so we know how it is and the needs of our people and how we meet it. We cannot afford curative healthcare. So the best thing for our nation is to think of preventing.
In the last 13 years, the Arise Work for Life has gone global and is done simultaneously in several countries of the world. With the outbreak of the COVID-19 pandemic, the idea of dividing participants into clusters was initiated in compliance with the preventive guideline.
We are working in clusters of not more than 25. There is no large number at all. There's no large number. What we find is that if we come together, we don't know who is the carrier, who is not the carrier. So what we're doing now is to be cluster. And what it has done for us as Arise, Work for Life, is that we're able to go global. You can work in your home. You can walk on your streets. You can walk in your places of work. You don't need to come together. It's the coming together is not what makes you active. What makes you active is get up your seat, put on your shoes, and begin to walk. So we are not coming together. We are going in numbers of not more than 25. That is what we did the year before, in the year 2020, and to the glory of God, not one casualty. Nobody caught COVID. And let me tell you one very interesting thing. In my cluster, I worked with all the doctors, the frontliners, those who battled COVID up front with their lives at the first instance.
Dr. Iluyomade is not only passionate about a healthy lifestyle, she yearns for a country where there is no social discrimination and disunity.
As a child, As a child, I heard the stories of Africa and Africans were suffering. And I had this vision of a greater Nigeria. I experienced Nigeria in my boarding school, Queen's College. We were all together. That is Nigeria, where ethnicity does not tribe, where there's tribalism, where we are one people, where religion never mattered to us and still does not matter. I am a Christian and I have a lot of Muslim friends as well. I am somebody who is from the south of Nigeria, and yet I've gone to Maiduguri, I've been to Sokoto, I've been to Kaduna, I've been to Uyo, I've been to Ekoma. There's nowhere in Nigeria I have not set my foot on.
Arise is a non-governmental organization that is committed to accelerating nation building through the empowerment of women in the society. In its 13 years of existence, the organization has done a lot to eradicate poverty, zero hunger, promotion of quality education, good health care, gender equality, and provision of clean water.
It is to alleviate the sufferings of our people in the area of dialysis. This is one of the greatest dialysis centers in West Africa as we speak, and the Lions, we are proud to be associated with it. It will go a great extent. Before now, we see a lot of places, the local places we have lined up with patients. Sometimes they don't even get the treatment they deserve because of the nature of the places they go to. But with this structure on ground, something great is going to happen. We are going to be able to reach out to so many patients at the same time, and a lot of the sufferings of the people living with dialysis, with kidney failure, will be alleviated.
I feel fulfilled that his legacy has come to come to reality, and his dreams have come true to help the poor, to help the nation. He actually worked as a civil servant. He worked very hard for this country, Nigeria, and I'm happy today he's been able to contribute his quota in the health sector to see these projects come true. Even though he passed on, but IOD, my husband, lives on.
What I saw, I can testify that this center of excellence was actually built with the contention that Nigeria is ready to stop medical tourism in the area of dialysis and renal pathology, because I have seen the state-of-the-art equipment, the facilities. They are what we are seeing all over the world. I mean, the standard is so marvelous, and I think we are ready. And I commend the administration of the present CMD, the Lion Club International, and all other stakeholders and partners for building this edifice.
Clinics will be run here. All diseases of the kidney for children and adults will be run here. Services like dialysis and other services concerning the kidney will be rendered here. Pathology will be done here. Our laboratory services for kidney disease will be done here. Research and training are also paramount to development of this facility in other centers. So we are going to be training Nigerians and people from all over West Africa and beyond on renal diseases in this center.
It would provide cheap and affordable renal facilities in Lagos. Hitherto, dialysis centers are very few in Lagos, and they are very expensive. But this is a private-public partnership that would bring the cost down, and it will make it to be affordable to Nigerians, and medical tourism would then be eliminated.
If you don't release your potential to the people, you will not benefit from the potential of the people. We have a platform, the Lions Club International, to say that we want to project and market kindness to people. Government cannot solve all our problems. The bit we can do can help alleviate the sufferings of the masses. The more you have today is just the gift of God. But please, let's spread it so that it can benefit mankind. It's a natural law of existence. Your peace can only be guaranteed by the peace of your neighbor. What we have today in our country is the consequence of our neglect. Service, I've always said, is a tool, is a culture and tool for social transformation. If you institutionalize the culture of service, even the face of governance will change. So charity and service to mankind with bonds of kindness is what we need to stay together as Nigeria.
Are you ready to support that? Go ahead with the installation.
Okay, we're in support, yes.
Yes, she said she is in support. Let us clap for that. Your sisters. Big man. Are you in support of Gabby's taking up this position, President of Uganda Unique Lands? And the abuse of the president, should we go ahead or should we suspend? Support. I don't want to take my senior brothers because he is a lion of all recruits. I just want to congratulate you that you are following the footsteps of the father of the day, who is a very great lion and whose son, Latif Sanusi, is also a very, very great lion. Thank you very much for supporting our group for doing this. Thank you so very much.
Thank you, my governor. Thank you, my governor. You have my permission to go ahead.
Thank you very much. You can go ahead, sir.
Having obtained the consent of his family, the district governor, Lion Kayode Oshinoga, proceeded with the installation procedure for Lion Oriyomi Adegbola Adetunji as the 9th president of Ikeja Unique Lions Club for the 2021 to 2022 service year.
Oriyomi Adetunji, you have been elected to the office of the president of your club, Ikeja Unique Lions Club. You are the chief executive officer and not the sole administrator. Your success is a reflection of your club's success. Now is the time to continue building your club in every way possible so that it will continue to be an example to other clubs. A credit to the community that we serve, the district, and the Lions Clubs International. The peaceful transition of power from one to the other.
I, Lion Sonia Oriazoa, President of Ikeja Unique Lions Club 2020-2021, I thereby strike this bond for the last time, handed over to my incoming for the year 2021-2022.
With a promise to improve on eye care and carry out operations for people with cancer and other health challenges, improving access to health care services will be getting more attention in this new service year.
It's a landmark. Well, it's an annual ritual we do, passing baton from one tenure to another every year. But this year is very exemplary because this club has risen in its 9th year of existence. They have risen to be very, very, very impactful club to their communities. And they are at their peak now. And at the time Oriyomi Adetunji is coming in, we have no doubt in his ability to maintain the momentum and even improve on the service activities of the club.
The aim of this event is to do fundraising for the project that we have identified for the year. First of all, I must say that we are going to be taking care of 10 pediatric cancer patients. We are also going to be doing a lot on diabetes. We are equally going to be doing a lot on environment. We have an Ikeja unique garden in Alausa there, which we have continuously maintained, and will continue to do that. We are also going to be doing 10 cataract surgeries in Lagos, Nigeria, specifically in Ikeja, where we domicile, and a whole lot of other things that we intend to do this service here. I say that I appreciate everybody who has come here to support me to achieve our goals and objectives of the Lions Club, which is to support the needy and the less privileged in our society. I sincerely thank all of them for coming today to my investiture as president of Ikeja Unique Lions Club.
My name is Arges. I was very privileged to be invited. You know, what the Lions Club do is a fantastic thing. You know, this is a country that can use a lot of help. But don't forget, Lions Club is all over the world. You know, there's good things being done by Lions Club everywhere. It's not only in Lagos or not only in Nigeria. So, you know, Lions Club is an organization that is to be commended. You know, any organization that selflessly gives without taking to help the community is a wonderful thing. You know, and that's why we came to support that. And we're proud that our employee, valued employee, is now, you know, president of this.
Lions Club International is a charity organization that is passionate about touching lives in the area of health care, environmental protection, support for quality education, youth empowerment, and eradication of hunger.
All of the new patients are seen by the resident doctors, some by the consultants, but the bulk usually by the resident doctors, and of course we review together.
Public hospitals in Lagos State are back to their usual busy routine with the suspension of the 62-day strike by resident doctors, and the patients are obviously happy. Some of the doctors said they had to shift grounds in the interest of the masses, hoping that government would not fail in implementing all the issues on the table.
We've missed being able to see our patients, and I'm sure our patients have also missed us. On the other hand, we're not very happy with the eventual outcome of the strike because all our demands have not been fully met. And we hope and pray that the 6-week window that has been given to the federal government will not be met with further disappointment.
Before the suspension of the strike, some of the medical personnel found their way out of the shores of the country in search of greener pasture.
I just hope that this should be the last strike.
If we really would want some level of improvement and not having other countries come into the country to take away our doctors, we need to look at how we pay them. If our politicians sit in the National Assembly and State House of Assemblies and they earn fat monies, how much more the doctors who cater to the needs of even the people at the grassroots level.
Tomorrow it could become the nurses or the pharmacists or the radiologists and so on and so forth. So it is to sit down and whatever agreements, whatever MOUs they sign with these people should actually be implemented, because what these people are complaining about is that we spend so much more money in frivolities and taking care of our leaders than putting into the health of the masses.
With an unimpressive rating of 187 out of 191 global health systems, the experts advised government to focus on the health insurance scheme and the referral system to avoid suffocating both the secondary and tertiary health institutions in the country. The CM4FP is a pilot study implemented to address the data gaps by producing high-quality contraceptive market data that is matched to consumer data to provide a robust picture of the complete market for family planning in Nigeria. The study was carried out in 4 states, namely Lagos, Kaduna, Niger, and Abia states. Speaking during the study presentation in Lagos State on the 8th of October 2021, some critical stakeholders applauded the initiative as a right step that will improve family planning in Nigeria.
Then the data has been collected and the analysis has been done and is being handed over to the State Ministry of Health here in Lagos State. Our findings, first of all, the project is about the behavior of women when it comes to uptake of health products like family planning products. We looked at the behavior of women, what influences their decisions. We looked at where they go to take up methods and services and why they go to those places. It's a longitudinal survey that was conducted in 3 rounds, okay? And then there was mapping and outlet census and mapping also of the households, which are the women who live in the particular local government area, Surulere, where this project took place. So and then the summary of the findings are, there are a lot of insights and learnings we got from this, but majorly what stood out is that there is a bypass. Potential clients, women who want to take up such services, bypass the health facilities that are around their immediate location, around their homes, and go sometimes up to 3 kilometers away from their homes to access such services. The other major thing we found out is that a lot of women access services from lower level healthcare facilities. But in Lagos State, a lot of women also, about 33% of women go to the hospitals and clinics for services. But across the 4 locations, much more women are found on the average to go to the pharmacies and the PPMV shops, the chemists, for such commodities and services. The other thing we looked at was stock availability. We found out that there is always some kind of in and out of stock in those facilities where women go for services. So at a particular time there will be stock, at another time there will not be stock. But though on the average there was stock stability. We also looked at cost, the prices, how does price influence the decision to take up methods. And that varied across the 4 states. The states are Lagos, Niger State, Abia State, and Kaduna State. So it varied. In Lagos, cost was not much of a decisive factor, but in some others of the states, like in Abia State and in Niger State, the cost of services and products was, one of the major issues that women considered when when making the decision to receive such services.
This dissemination is coming at the best of time. We need a lot of innovation if we must sustain access to family planning commodities. Innovation in market approach, innovation in funding, innovation in distribution of this commodity. So it is strongly believed that activities like this that has generated a lot of learning should be able to inform us on the best way to go ahead. And that is why government is quite very keen in the collaboration we have been having on this project up to this point of dissemination. It's really a great job that we have done. And having generated a lot of data and a lot of learning, we need to look at the best way to make use of this data so that our research will inform practice and we can leverage the information we have to improve services to Nigerian women and young girls. That is the only time that research will make meaning to an average Nigerian.
Welcome this document because as scientists we have to ensure that when we plan for the state we use evidence, and this research work has provided evidence to tell us that what we know is what we know, and our interventions are along the lines of the findings of this research work. So we're very happy to have found this research work. It has also opened up a few other questions that at the state we need to answer. Questions around why people will skip some facilities and go to other facilities that are a few distance away from their house. Does it have to do with confidentiality, not wanting their spouses to know? So it means there's still some work we have to be able to do in terms of creating awareness and the acceptance of family planning services.
Consumers Market for Family Planning, CM4FP, is a Bill and Melinda Gates Foundation and the Population Services International PSI-funded project implemented by the Society for Family Health in Nigeria. Nigeria, although Africa's largest economy, was potentially the highest concentration of medical schools and universities on the continent, according to the Director General, Nigerian Institute of Medical Research, Professor Babatunde Salako. Faces some of the worst public health challenges, including the highest global burden of malaria, HIV, tuberculosis, and other emerging infectious diseases such as Lassa fever, cholera, meningitis, and lots more. The situation has been attributed largely to insufficient number of world-class researchers and scientists to conduct research that inform policy and development of vaccines, medicines, and technology to address the nation's healthcare needs. It is to bridge this gap that the Nigerian Institute of Medical Research Foundation was birthed. It was officially unveiled to the public on Tuesday, 12th October 2021 in Lagos, Nigeria.
Our contemporaries in the United States, in the United Kingdom, in South Africa, in India, are undertaking groundbreaking, far-sighted developments in life-changing research for biosciences and also biotechnology. It might surprise you and might also interest you to know that this institute has demonstrated a clear ability to undertake research and produce devices and therapeutic remedies that have been very, very life-changing for people in areas related to sickle cell, anemia management, in areas related to testing for COVID-19 virus during the last pandemic. But its real challenge lies in how much research, how much resource in terms of funding it is able to mobilize. And this is where the Nigerian Institute of Medical Research Foundation, I emphasize that foundation, which is a voluntary organization initiated by the Medical Institute of Medical Research, comes.
We hope that the launching of the foundation will bring in opportunities for private funding of research, health research in Nigeria, and that will mean that outcomes of research in terms of innovations and products, and we are targeting medical devices, vaccines development, drug development, and even though these are things that take some time for it to be completed, the fact that they are already in the process suggests that in future NIMR will be contributing to the health needs of the nation, and that will have a direct impact on our health indices, because we will be coming out with products of research, not necessarily done in NIMR alone, because the foundation will fund research done in universities in Nigeria and other health institutions, as long as they are health research. And so whatever product has come there will become very useful to the Nigerian community. The fact that we are not going to be importing such products and that they are going to be developed within homegrown, as it were, will make it cheap and make it available to the public.
Discovering something is one thing, taking it further and actually going further to make it into something that is commercially viable. It's a strenuous and very complex process, and those two key things are what we'll be doing: building capacity for translational research and commercialization of those research findings.
You've seen all of us. You've seen the chairman, Mr. Babatunde Raji Fashola. You have among the members myself, Mohammed Sanusi II, Serikin Kano. We have Mrs. Mojima Kanjola, Professor Oye Gureje, and Professor Onidibe, all of whom are here. The Board of Trustees is to be assisted by the Research Advisory Council of NIMR, consisting of persons drawn from the Institute's administration, researchers and members selected from public and private institutions, industry, and globally recognized researchers and entrepreneurs. The role of the Research Advisory Council is to provide technical advisory support to the Board of Trustees in respect of decisions around research priorities for the foundation and its strategy for achieving innovation and commercialization of research and development efforts. The advisory board will also provide support for the foundation in attracting grants from national and international funding and donor agencies and corporations. As has been mentioned, research so far has been aimed by individuals at seeking promotion and has not been tied to a national or state health agenda. So we expect the advisory council to provide direction on research. The second organ is the management committee, and the management committee of NIMR Foundation is in charge of the day-to-day operations of the foundation. The team consists of the executive director and the team leads for the 5 departments of the foundation, and the executive director at the moment is Dr. Olajide Shobande, who is right here beside Professor Salako. There are departments. We have a program management department, which is responsible for design, operationalization, and monitoring and evaluation of foundation awards and training, design and review curricula for the different types of awards and trainings, oversee training, placement, and mentorship of all awardees, and in conjunction with administration and management unit, oversee performance management for all awardees. The second department is the Strategic Partnerships and Business Development Department, responsible for the identification and formation of partnerships with stakeholders, including industry, academia, research institutions, etc., and leading activities of the Innovation Hub and commercial ventures of the foundation. Third is Administration and Management, which is the first contact with all incoming requests for agreement and tracking of their timely execution. It also manages implementation of contractual agreements related to commercializing technologies and patents which are incubated or developed by NIMR Foundation.
Research is very important in ensuring that we have a healthier grounds for which Nigerians can access and demand for health. And what is most important is that we have some peculiarities as blacks, which hitherto are not addressed by a lot of Western medical intervention. We need to start doing this, using research as the main way forward. And the media has an important role to play. Media must be able to explain, media must be able to accelerate, media must be there to ensure that a lot of these things are in-country built and sourced. That way, sustainability is assured.
We have a lot to do. And the work of the foundation will be made easier based on the products that come out of NIMR to a large extent. So communication is very important. I don't know what we have at the moment, because I know the system in our institutions is the chief press person or whatever is attached to the office of the Director General, is attached to the office of the minister, and so on and so forth. So we need to, the foundation needs to look at issues that have to do with communication. Things are happening. Presently, there's a vaccine for malaria and so on and so forth. Someone is doing a story on it already, and I have the liberty of getting writers from, across the continent to write on these things. Sometimes you can't find writers even among our colleagues.
The event provided an opportunity for speakers to remind Nigerians about the importance of preventive health care.
These are the areas where the foundation is going to face, because for us to be able to bring down these deaths coming from these diseases, we will need to be able to make diagnosis. That's why we have developed the diagnostic kits for both Lassa and yellow fever. We also need to be able to treat them, and we also need to be able to prevent them.
Welcome back. Health insurance scheme is one of the health financing options adopted by countries, states, or individuals to improve healthcare access. Nigeria, also in an effort to improve healthcare access and reduce the burden of out-of-pocket payment, adopted the National Health Insurance Scheme. Many years down the line, not much success has been recorded. Lack of understanding about how the process works has also been a major challenge. I spoke with a cross-section of experts about the Nigerian health insurance situation, the challenges, and the way forward. They will also be talking about the modus operandi of healthcare insurance at the state level, with Lagos State as a focal point.
I think one of the things that we should start to look out for is that now that the health insurance is getting momentum in Nigeria, we need to not look at the back. We need to look forward. The experience so far, if we look at it, has not been so palatable because of the law that enacted the National Health Insurance Scheme that is not mandatory. And that has been a big bane on the National Health Insurance Scheme in Nigeria. However, there are moves now to amend the law. It's already passed the House of Assembly and waiting for the assent of the President. And I'm sure that once that is done, there will be a big kick in health insurance in Nigeria. However, for us in the scheme, we have tried so many things, and one of it is what we call the health insurance under one roof, by making sure that we kind of decentralize health insurance to the states so that the states can have their own health insurance. And as of today, out of the 36 states in Nigeria, I think we have about 35 states that have signed their health insurance law as at now. So I think the health insurance is picking up very well.
So where did we get it wrong at the national level, and then where do we need to make the necessary corrections?
At the national level, one of the first things that hindered the expansion of the health insurance is the law that established the scheme, because the law at the initial stage was not made mandatory. And that actually made everybody to say, since it's not mandatory, I don't need to join. So when it started in 2005, you will actually see there is the federal government workers that actually kickstarted it, and the states refused to join. And that's one of the reasons why we said, let's decentralize to the states. Let each state have their own pocket of health insurance. Though it might not be the best way to go, because insurance is all about pooling funds. And once you start having fragmented pools of funds, it's not going to be so effective. But for now, that's what we can do. And like I said, we have actually amended the law. I'm waiting for the presidential assent. Once that is done, then we are okay. In terms of education, a lot of people still don't believe in insurance for so many reasons. Some because of their religion, some because of cultural beliefs and things like that. Because a lot of people believe that you don't need to prepare for what has not happened. There are some religions that don't even want to hear insurance because they don't prepare for, especially for health. And that's one of the things that we are trying to do now. With the decentralization into the states, I think a lot of people are getting to understand the advantages behind insurance. Insurance basically is to pay for what you don't need now, so that when you need it in emergency cases, you don't need to pay out of pocket. Our out-of-pocket expenses in Nigeria is still very close to about 70%, which is not so good for the country. A lot of people don't actually understand the benefits behind it. And one of the main benefits, number one, is that what you even pay in a year, we have a program that we call GiftShip, Group, Individual, Family, Social Health Insurance Program. It costs 15,000 naira per person per year, and that is quite cheap. That's all you need to pay. And at the point of care, you don't even pay a kobo. The only thing you do is a co-payment on the drugs that has been administered, and that's just 10% co-payment. Outside of that, you don't pay. And you find out that most times when people get to the hospital, they need to pay to even see a doctor. But under health insurance, you don't need to worry yourself about that. And health is not something that gives you notice and tell you that I'm going to make you sick next year. So the most important thing about health insurance is for you to have prepared for your health care so that when you need the health care services, you don't need to pay anything. That's the best advantage about it. And it's quite subsidized. The whole idea is the healthy to pay for the sick, the rich to pay for the poor. You might pay, just like you're saying, and you don't need to go to the hospital throughout the year. Somebody else is utilizing your fund, and that's the whole idea. You share risk, and then you share costs. That's the way it works. Because some people are sicker than some. In going to the hospital, you can treat both people. Some people are richer and some are poor. When you get to the hospital, the rich has paid, the poor has paid. You use the money for the rich to pay for the poor. You use the money for the healthy to pay for the sick. And that's the best advantage of health insurance. Lagos happened to be the first state in the country to sign their law in 2015. And they are trying a lot to be able to kickstart what they want to do. Just like at the federal level, they have been able to enroll the public servants in Lagos State. And now, with the introduction of what we call the Basic Healthcare Provision Fund, the Basic Healthcare Provision Fund is a donor fund that was given by the federal government to ease healthcare, especially for those that are vulnerable. And that's one of the things that Lagos State is also concentrating on now, to identify those classified as vulnerable. Those are the poor people that cannot even afford healthcare services, and take them on and finance them with the Basic Healthcare Provision Fund. We have what we call the social health insurance, and then we have what we call the private health insurance. For the social health insurance, it's always very difficult to put, especially these non-communicable diseases that you mentioned, to put them into the pool of the social health insurance, because it's a social health insurance with a basic minimum package. And the funds are not as deep as taking those ailments. Number one, they are terminal ailments. They are ailments that you don't even know when they will end. And as much as possible, we try to avoid putting that heavy toll on the social pool. However, there is what we call the private health insurance also, which is like a top-up. Though it comes with a little bit more cost, which some people might not be able to afford. But what we're hoping is that in a very short time, if health insurance is made mandatory for all citizens in the country, one of the advantages will be that the pool will be larger, the funds will be larger, and then you can take more of these non-communicable diseases. And that's where we are planning to go. For now, what we do is that initially for people with diabetes and people with cardiovascular diseases, we give chemotherapy. The first 6 chemotherapy is free. And then dialysis also, the first 6 dialysis is on the health insurance. After that, there's a co-insurance that needs to be joined between the patient and the HMOs. It takes 2 to tango. The government cannot afford to pay for healthcare services for all Nigerians. And that's why we look at different sources of funding. We look at, yes, the tax is there, but how much tax can you tax the citizens? And that's where the private sector needs to come in. It's a public-private partnership. The private sector, a lot of them are doing donor funding, which actually goes parallel with what the government is doing. And sometimes it does not have an impact. We need to be able to pool our funds together and be able to channel it to take care of the health care services of people. And then for the populace also, everybody needs to gear up. If it is made mandatory, a lot of people will need to pay. And that is one of the things that we are hoping for in the National Health Insurance Scheme, so that at a stage, everybody must contribute into the pool. And with that, healthcare services can be given to almost every Nigerian.
The key thing is this: you never know when adversity will happen. That's the truth. No matter how much you plan for it, you never know when something bad will happen. So that's why you need to have health insurance as a whole, and in particular health insurance. At any point in time, any health challenge can befall anybody. Nobody breaks on that, but it's inevitable. Somebody will have a health challenge at any particular point in time. So it's better to be prepared. And it's not when you have that situation that you start looking for money. You need to have some form of protection, such as when you have that problem, there's already money I've set aside and then available, and that's the insurance money. So how do you benefit from it? So if you're a single person in Lagos, just you alone, doing your hustle in Lagos, working, its premium is 8,500. So single person above 18, it's 8,500 for that particular person. But if you are married and you have children, for a family it's 40,000. That's husband, wife, and maximum of 4 children is 40,000. Now what we've done is that we know that there are people that have multiple wives and more than 4 children. So there's actually provision for additional children and additional wives. Of course, there's provision for additional premium to accommodate these additional family members. So that's where we are right now. All the things that are occurring in Lagos, what are the medical conditions that most people suffer from, and those are the things that we focused on. So I always say that nobody in this Lagos or in this Nigeria can say in 1 year they don't have malaria. So definitely malaria is covered. So those are some basic things. Of course, there are more things. There's consultation, there are lab tests, there's drugs, there's hypertension, there's diabetes, there's antenatal, there's delivery, there's CS, there's some surgery, some basic surgeries. So those are things that we cover. But what we looked at is the most essential things for the vast majority of people, such that if you ask 100 people, at least 60% would have experienced it or are currently experiencing it. So those are some things that we're focused on right now. It's a constant process. You keep advertising, encouraging, and regulating and engaging. It's constant advocacy. I want everybody to be on board on this train and enjoy the benefits of the scheme.
My name is Dr. Shodikpo Oluwajimi. I am a consultant family physician. I've been to the isolation center and I've seen people struggling to breathe while they use oxygen. We have a responsibility to prevent this deadly illness. Use your face mask. Practice social distancing.
Wash your hand all the time. Prevention is better.
Together, we can fight coronavirus.
If you are just joining us, it's Health Affair on AIT. Next on the program is our nutrition segment.
Tomato is an edible berry plant that originated in Western South America and Central America. The tomato is a nutrient-dense superfood that offers a lot of benefits to the body system. The nutritional content of tomatoes supports healthy skin, weight loss, and maintenance of the heart. Tomatoes, according to some scientific reports, are now the 4th most popular fresh market vegetable after potatoes, lettuce, and onions. Including tomatoes in your diet can help protect against cancer. It helps to maintain healthy blood pressure and reduces blood glucose in people with diabetes. Eating tomatoes can also help protect the eyes against light-induced damage. Tomatoes can be consumed by adding them to sandwiches, wraps, in sauces, or alternatively cooked to boost the availability of key nutrients. Tomatoes are a great source of folate, which is very essential before and during pregnancy. 1 cup of chopped or sliced raw tomatoes contains 32 calories, 170.14 grams of water, 1.58 grams of protein, 2.2 grams of fiber, 5.8 grams of carbohydrate. Tomatoes also contain several vitamins and minerals.
On our clinical segment, we'll give you vital tips to stay healthy. Welcome your contributions on how to improve the nation's health sector and human lives on our past session segment.
My name is Emmanuel Belago. The Nigeria health sector this time around is not okay. People that have too much money are people that are benefiting, but they can afford of going to abroad, get themselves treated. But we now, as I'm coming out now, because I don't have too much money, not financially buoyant enough, That's why I just go where they are selling abo, buy abo, drink for malaria. You understand? In a way that they can make the thing better is that let General Hospital, where people normally go and take treatment, be okay for people, so that whenever you are sick, you can go down there and take a card, meet a doctor, the doctor examine you and tell you what is happening to you, then the prescription, they write the prescription for you. If you can buy it at the hospital there, you buy it there. If you cannot be able to buy it there, you can go to any elsewhere and buy the drugs so that you can be healthy.
The best thing, if President Muhammadu Buhari can stop it, that nobody should be flown out of this country if the person is sick because of any reason. They should be patronizing. We have private hospitals, we have general hospitals. Let them go there now. The general hospital, the private are not meant for animals, it's meant for human beings. So let them go there so that they will see what we are facing. At least if you go there, even the condition you see there, so that might even tire you.
They are trying. At least for the new government we have now, they are really trying. Unlike before, when you go to general hospitals, stay hours. But presently now, the presently government we are having, they are really trying for us. God bless them, they should keep on. Doctor aspect of it, let them work towards that area. They should stop going for strike every time, make people die.
This is where we draw the curtain on the program today. Thanks for spending your time with us. Please kindly support the program by advertising your health products and services at a subsidized rate. My name is Oshomowa Daniels. See you same time next week. And please keep staying safe.